One of the federal provisions of the COVID-19 public emergency was states weren't allowed to remove anyone from Medicaid rolls, even if those individuals no longer qualified for Medicaid. Once the public health emergency ended on April 1st, that provision also ended. Starting in February, the Idaho Department of Health and Welfare began the process of reaching out to 150,000 Idahoans on Medicaid to see if they still qualify for the program based on income and residency guidelines, and giving them 60 days to respond. That redetermination process is ongoing and is scheduled to wrap up later this summer. On Friday, I sat down with Shane Leach from the Idaho Department of Health and Welfare to get an update on how that process is going, how many people have been removed from the Medicaid rolls so far, and whether it might save the state any money in the Medicaid budget. Thanks so much for joining us this week. First of all, how many people have received requests from the department to engage in this redetermination process?
Yeah, currently there's 153,000 people in what we call Medicaid protection. So those are the individuals that'll be due starting from April 1st. We're continuing the unwinding through July. Currently, we've noticed over about 100,000 of those individuals to actually respond and follow up with their redetermination.
When you say that you've noticed these individuals, that means you've started the process reaching out to them and asking them to prove that they're still eligible, basically.
Exactly. Each month we send out a different volume of renewal, so not all at once. We've been spreading them out over time.
So in that group of about 100,000 people, what's the response rate so far?
Yeah, currently we've processed about 50,000 individuals of all the people on Medicaid protection.
So you've processed them, and some of them, of course, have been removed, and we'll get to that in a second. But how many of those folks have been removed because they just didn't respond?
Yeah, we're still working on that number. The end of this month, the end of May, will be the first month that we'll actually end individuals' coverage that have not responded yet. Even though we've started the enrolling, noticing people to respond to us beginning actually in April, this will be the first month of actual closures if people don't get in touch with us.
Got it. So of the about 50,000 people who you have already processed, how many of those have been removed from the Medicaid rolls?
Yeah, about 30,000 of those are no longer eligible and 20,000 are still eligible.
So more than half,
yeah,
basically. Let's talk about the reasons that those folks are no longer eligible. I'm assuming that most of them are because of income requirements.
Correct. Could be many reasons, of course. A lot of these individuals have been on what we call Medicaid protection for the last couple of years. Because of the pandemic, we were not able to disenroll anybody unless they called us because they wanted no longer coverage, passed away, of course, or if they actually moved out of the state of Idaho. And so because people have been on Medicaid during the public health emergency, not completing renewals, life changes, right? A lot of changes have happened in the last couple of years. So exactly, many people are over income, but there's also part of that eligibility requirements could be family size, can impact things, right? If the family gets smaller or bigger, could obviously change the eligibility limit. Resources for part of Medicaid, which is aged, aid, blind, and disabled is one of the programs, and so different things like that, of course, can impact eligibility.
This was a big push during the legislative session. During the session, there were some lawmakers who said that they wanted the Department of Health and Welfare to move even faster on this redetermination process, while a handful of people said that a 6-month timeline was too fast to process 150,000 people. How is your division balancing those two concerns?
Yeah, it's a great question. Obviously, there's a balance between our current workforce, our current workload that we have from day to day, and this additional 150,000 individuals to process is on top of all of our daily work. So we certainly had to balance that between the needs of the legislature to obviously focus on completing our renewals and working with our federal partners who actually are providing up to over a year to process individuals, because they want to ensure, of course, not only that we do it timely, but also accuracy is involved, and we make sure people have enough time to get in touch with us and be able to complete the renewal to see if they're still eligible or not. So with all those factors in, right, we kind of looked at to understand what can we do based off previous experience, one of those being Medicaid expansion. So in 2019, we went through Medicaid expansion, which caused a really big increase in number of individuals on Medicaid. So we have some basis of what we can handle, which is kind of on top of our caseload. And looking at Medicaid expansion, other annual periods of open enrollments when we work with our state-based marketplace, we have really big spikes in workload as well. And so anyway, we put all those factors together, and that's kind of what gave us the path to know that we could do this within a 6-month period.
Have there been any unexpected obstacles that your staff has run into?
No real unexpected obstacles. You know, one of our biggest things, of course, is, you know, we're doing everything we can to notice all of our participants, get in touch with them. Because it's been over a couple of years now since we've heard from a lot of individuals, and that is one of the concerns with our federal partners as well, of course, is reaching people, making sure they get our notices, and then they have the time to respond. So that's just an obstacle. I think it's an expected obstacle. We know that's there. It's a concern. It's not just Idaho, it's across the country. So we're working diligently to actually go above and beyond the CMS requirements to actually notice people, send additional notices. We're also working on sending individuals text, for example. So we're trying different modalities to do our outreach to make sure people know they need to do something. And if they don't follow through on getting in touch with us and completing the renewal, they may actually lose their benefits.
Those who lose those benefits, to be clear, get automatically referred to Your Health Idaho, the state-based insurance exchange.
Correct. If they do get in touch with us, we complete the renewal. We find that they're over income. Those are the main ones that then would get transferred over to the state-based marketplace. The state-based marketplace, Your Health Idaho, then we'll work with those individuals to see if they can qualify for that advanced premium tax credit, so an APTC, which would give them obviously a reduced cost for a subsidy. So it's a really good transition for individuals that may now no longer be eligible for Medicaid, but could qualify for the tax credit.
And this came up at the Department of Health and Welfare board meeting earlier this week, but not everybody will qualify for that tax benefit on Your Health Idaho, but many of them do.
Yeah.
One reason the legislature was so keen on this process was to cut Medicaid costs. You know, the Medicaid budget has been rising because of so many factors. Do we yet know how much these the 30,000 enrollees who have so far been removed have? Do we know yet how much they were contributing to that rising Medicaid budget?
Yeah. We don't have all that information right now, obviously, until we're completely through the unwinding, because I said there's the individuals that have responded and are no longer eligible. There's also a lot of the individuals that we haven't heard from yet, right? And we just don't know. They may follow up, they may come back. There's a thing, a term we have which is called churn within our roles, which means maybe people might fall off and then come back on. So we'll be in the process of measuring that for a few months. One of the concerns I would add is, of the 150,000 rough people on Medicaid protection, I think about 60-something thousand of those were actually on Medicaid expansion. And so that was a lot of the discussions, I believe, with the legislature of these individuals, not only just the Medicaid protection, but how many are on Medicaid expansion as they're looking at costs. So as we go through, obviously, the unwinding, that will follow up right after this summer once we have that information.
And to be clear, there are a lot of different factors in the Medicaid budget. It's not just the number of people who are enrolled in Medicaid.
Yeah, very much so. I mean, not everybody's going to the doctor, of course, right? They may be enrolled. You know, a lot of the population is children and adults, so obviously different cost. And there is a lag time, of course, between when, you know, going to a doctor and claims might be submitted and then ultimately paid.
All right, Shane Leach, Administrator for the Division of Self-Reliance at the Idaho Department of Health and Welfare. Thanks so much for joining us.
Thank you so much. Thanks for having me.